That's the main difference between the Epley Maneuver and the Brandt-Daroff Maneuver. If you're suffering from vertigo, the Brandt-Daroff Maneuver or exercise is something that can give you considerable relief if you try it out for a few weeks. Here's how you do it. You're gonna start off sitting on a bed or even a mat or couch, and I like to set up a pillow on either side to give your neck a little bit more support. You're going to turn your head 45 degrees away from the direction that you're going to lie. So if I'm going to lie on my right side, I'm going to turn my head to the left, not 90, but 45 degrees, right in between. And the direction that you go to start is the direction that you have more of your symptoms. So if you get dizziness provoked by right sideline, start to the right. Now, you might want to make sure you have a trash can nearby because this can provoke considerable dizziness, especially when you start with the exercise. So off we go, down, looking 45 degrees. I have my legs supported. And I'm going to stay here 30 seconds if I do not get dizzy. If I do get dizzy, I wait until the dizziness subsides, plus 30 seconds. Once that period of time is up, I'll sit back up straight. Once I'm in the straight position, bring my head back on. This would be position 2. So that was position 1. This is position 2. Stay here 30 seconds or until the dizziness subsides, plus 30 seconds. The next step would be, you guessed it, go to the left side, head 45 degrees away, and then down we go. Same rule of thumb, 30 seconds, or wait until the dizziness subsides, plus 30 seconds. Once that period of time is up in this position, you're bringing yourself back up to neutral again, 30 seconds, or until the dizziness subsides, plus 30 seconds. Stage 1, 2, 3, 4. That counts as 1 repetition. You're going to do 5 repetitions, so it'll take you about 10 minutes to do the whole series of exercises. You can start off trying to do that twice a day to see if you're able to get some improvement in your vertigo. Now, the entire reason for my channel is to help bring you information to cut out unnecessary surgery and treatment by getting to the root of the problem. This exercise can help treat your vertigo because it's a habituation exercise. In other words, it strengthens your inner ear. Instead of taking medication, which masks the symptoms, like meclizine, which just basically takes your nervous system and quiets the whole thing down, this will actually strengthen your inner ear so the dizziness does not bother you as much. Now, the way you're going to strengthen that when you do this exercise is you try to progress to each phase more quickly with the movement. So each time you do it successfully, you're going to then the next day try to do it with a little bit more speed, like that. Okay? And then you would just rapidly change the positions with more speed. And that's building the strength of your inner ear to be able to position, change, and stabilize. Studies have shown this exercise can be effective at reducing your vertigo, but if you have true BPPV or positional vertigo, the Epley Maneuver is far superior to the Brandt-Daroff. So first thing that's key is getting an appropriate diagnosis, and then if you have that positional vertigo of the posterior canal, you want to make sure you do the Epley Maneuver. This positional vertigo technique is less specific and can help by strengthening the inner ear. The Epley Maneuver is going to be more to move that crystal around your inner ear and to get it out. Find out if you need the Epley Maneuver and how to do it, click up here. To cut out unnecessary treatment and help you keep it moving, subscribe by clicking over here.